Yesterday, U.S. Senator Ron Johnson of Wisconsin held a panel discussion on the global response to COVID-19 that featured about a dozen doctors and medical experts. Now, the aim of the event was to provide a different perspective on the pandemic response, what you're not hearing in the media, discussing what went right and what went wrong, and what should be done now and what needs to be done in the future as we address future pandemics. You probably didn't see anything about it in the media. Why is that? Well, joining us now to talk about the panel discussion and why nobody wants to report on this is Senator Ron Johnson. He serves on 4 Senate committees, including the Committee on Homeland Security and Government Affairs, Committee on Commerce, Science, and Transportation. Senator, welcome back to the program.
Hello, Tony. Thanks for having me on.
So, Senator, you had doctors, medical experts who were there to kind of evaluate what's happening globally, but I looked and looked. It was so hard to try to find information. Most of what I found was a couple of negative articles. What are people afraid of when we have these conversations about what's going on?
Well, certainly in the legacy media, the big tech giants in the social media, as well as our public health officials, they cannot afford to be proven wrong. 889,000 Americans have perished in COVID. And of course, we've been listening collectively to a group of public health officials. Many of them don't practice medicine. Few, if any of them, have ever treated a COVID patient. And so what I tried to provide the American public yesterday was a second opinion coming from doctors who have actually had the courage and compassion to treat thousands of COVID patients. They expose themselves to the virus. They've treated patients successfully using cheap, generic, widely available drugs that have been around for decades with an incredibly strong safety profile. And so if I've got a serious medical condition, I'm going to go to a doctor who actually treats that medical condition as opposed to some academic or somebody sitting in a federal bureaucratic office. But that's not what we've done here, and that's certainly not who the legacy media has listened to. And so the bottom line is they can't afford, the legacy media, they can't afford to be proven wrong, because if they did, the body count is getting so high, the consequences of the censorship of their misinformation. They accuse somebody like me of, when I just tell the truth, of spreading disinformation or misinformation. They are the ones that have suppressed this, that have kept people from accessing early treatment, which, just like any other disease, it's early detection, allows for early treatment, provides better outcomes. I mean, don't we do that with cancer? You don't want to wait till stage 4. Right. You want to catch cancer in stage 1. And yet we're NIH guidelines to this day, if you test positive, is to basically do nothing. Go home, afraid, isolate yourself, maybe Tylenol, try and get monoclonal antibodies. The variants are moving on, making those a little less effective, but you can't get them anyway. Otherwise, just hope and pray that you aren't sick enough, because when you go in the hospital, they haven't really advanced their treatment in 2 years. They're still using remdesivir. Very little scientific basis for using that, quite honestly. So, no, this is a travesty that's occurred. I hope Americans start waking up.
Yeah, that's another one of the abnormalities in this, that there's not been tests over the last two years and an analysis of treatments. I mean, we're still stuck. It's like we're in a time warp. Now, you had medical experts, as you said, those who actually have treated COVID. They've been involved in this. The structure of the panel covered what was identified as 4 pillars of pandemic response. What were those 4 pillars, and what came out of the discussion yesterday?
Yes, so Dr. McCulloch laid out these 4 pillars in November of 2020. It was at my Senate hearing with Dr. McCulloch, Harvey Risch, and George Fareed. After that, by the way, the New York Times ran a column by the Democrat witness, Dr. Jha, who holed up in an apartment, never treated a patient. They titled it "The Snake Oil Salesman of the Senate." But in that hearing, Dr. McCulloch laid out the 4 pillars. The first one is limit the spread. The second pillar is early treatment. The third pillar is hospital treatment. And the fourth pillar is vaccines. Those are the 4 pillars of pandemic response. We've completely ignored early treatment. Even worse than that, the health agencies, the Fauci's of the world, sabotaged early treatment. So it's still not very well available to most Americans. And as a result, and I agree with these doctors who say this, probably at least 500,000 Americans died that shouldn't have died. Because if you catch COVID, certainly in the first 72 hours, but first 5, 6, 7 days, you use these cheap generic drugs, you have a really good chance of surviving.
And it looks like the government's sole focus has been on the fourth pillar, the vaccines. Is this driven by big pharma?
I don't know how else you can conclude anything else. The only drugs recommended by the federal agencies are the ones that are novel, expensive drugs by big pharma. All the other ones, and we've seen the charts with a large number of studies that show these things are effective. They don't recommend any generic drugs. It's all drugs, $500 and above. Remdesivir is over $3,500 a course.
Well, Senator Johnson, we appreciate you staying on this issue, even though everyone has tried to silence you. In fact, this was not on YouTube. It's on Rumble because YouTube has knocked you off. But we appreciate you continuing to try to educate the American public.
Well, thanks for having me on, Tony. God bless you.
All right, Senator Ron Johnson.